thanks for joining me, you guys.
Yeah.
And
yeah, sure.
what we're going to do is we're going to go ahead and discuss some of the common pelvic floor concerns. So these are not like an all-inclusive list of things that can go wrong or things that you might deal with, but they're very common. And so, hi, Amber. Thanks for being here.
Hi.
Hi. Okay. So you guys don't have to like raise your hand or say that you've had pelvic floor concerns, but I know I have. So some of these things that we'll talk through are going to be, things that I've personally overcome and had to kind of rehab for myself. So this might be a little bit review for those of you who came last time, but I just wanted a quick overview about me. My name is Lindsay. I think all of you guys know me and you were here last time. So essentially, I've got my doctorate in physical therapy in 2016. My husband and I, we run our own business called Saldana Physical Therapy and Wellness. And I'm really passionate about working with women of all stages and all ages. And I really like helping women feel strong and empowered in their bodies. So a little bit about my process. I offer in-person and online treatment options. Sometimes right now I'm playing around with group coaching and seeing how that goes, because I know sometimes if you know that your friend is going to go to therapy, you're going to make it. So about today's webinar, the first one, just as a review, was basic understanding of pelvic floor anatomy. So we talked about how the pelvic floor functions with our diaphragm and our breathing and how it's meant to be strong in a contracted and shortened position, and it needs to be strong and capable in a lengthened and relaxed position as well. So today we're going to talk about things that can go wrong. And then the next webinar next month will be kind of your roadmap of treatment, prevention. And then if you're local, there's going to be an in-person event in Scottsdale that's going to be at a gym, and we're going to put some of these principles to practical use.
Oh, that'll be fun.
So today's objectives, what we're going to do is understand some of the basic common pelvic floor concerns. And sometimes, even if you're not having symptoms right now, you might think, why does this even matter to know all of this? Well, essentially, we're ever changing, right? We're never just going to stay in one phase of life. It is really good to know what's ahead of you, right? So if we're perimenopausal or menopausal, or maybe we're going to have kids, or maybe we're going to start going to the gym a little bit more, and then all of a sudden you're lifting weights and you start peeing your pants, or you have pressure, right? These are all things that we would like to know that, hey, that might be a pelvic floor concern. I should probably look into that, as opposed to just, oh, well, I guess this is how it's going to be for the rest of my life. Okay, so if you guys feel comfortable talking about this, feel free to unmute, but if not, no worries, I'm not going to call you out. But have you ever wondered why you leak when you laugh, or maybe if you feel pressure kind of down there after a long day? Anybody just curious?
Yeah. Can you hear me?
Yeah?
Okay. Yeah, at the gym the other day, I had an issue. I was doing squats, and yeah, I had a little leakage.
Yeah.
And not all the time, but I was kind of surprised that, anyway, I guess that's normal.
Well, I mean, it's not necessary. I wouldn't say it's normal, but it's common, right? So a lot of times in the pelvic floor space, we talk a lot about like trying not to just normalize things that we experience, because even if you leak and it's not all that often, it's not something that we need to just live with when there are treatment options for it. So some people choose and they opt to just deal with it because it's not that disruptive to their life, and that's okay too. Okay, so thanks, Shelley. So common concerns.
I'm sorry.
Go for it.
Hi everybody, I'm Michelle. So I don't have the leakage problem, but I have like extreme throbbing, like crawling out of my skin pain down there. And in my glutes, and I tried to do a pelvic floor yoga class today in my home. And I've been doing yoga for 20 years, not for the last 2 years, but I couldn't even do a bridge pose. The glute pain was so intense. And anyway, so I don't have any leakage problems, but I just didn't know that this whole thing was connected. And so I am going to physical therapy right now. And I talked to her about it today, and she had me do the diaphragm breathing and then, slowly do the bridge poses. And I could get up a little bit further, but I was shocked this morning when for years I could do a bridge pose, and then all of a sudden now I can't. Yeah.
Yeah, unfortunately, everything is so intertwined and interconnected that one thing can't work in isolation from the others. And so sometimes with pelvic floor tension, tightness, and then maybe overactivity, it can radiate pain to other parts of the body. And then all of a sudden, you're limited in function that maybe you didn't have that issue before, but now you do. So I'm so glad that you're working with someone and that you can get some more answers and guidance with that.
Yeah, and I find it like during the day when I'm working as a hygienist that it just gets worse and worse. But it's, it's the stress of the day. It's running behind, and then I'm clenching every muscle, and it's like that. But that down there is just, I want to come out of my skin. So bad.
I'm sorry, Michelle. That sounds awful. Oh man.
But I love what I do.
Yeah, and you're doing something about it. So
Yes.
These are all positives. And then hopefully with your therapist, you can work a little bit more holistically and globally, talking through stress management and posturing during your day and movements and all of those other areas of life that can impact the pelvic floor. Yeah. So thank you so much for contributing and sharing with us. So it is a common thing that people experience pelvic floor symptoms, but we don't want to just have to live with it, right? Sometimes I tell people, imagine if your best friend or your kid came up to you and they were like, I can't do squats because I'm in so much pain in my pelvic floor. And then you're just like, all right, that kind of sucks to be you. And then you just move on. No, like you would actively try to find an answer for them and help them overcome their concerns. So we never want to just kind of forget about it and not do anything about it. Okay, so this is a little bit of an overview of common pelvic floor concerns. I had an image here and it disappeared, but it's not important. We'll see how it goes. Anyone ever heard of pelvic organ prolapse?
Yeah, I'm not quite sure what it is.
Okay, well, I'm glad you're here then. We've got pelvic organ prolapse. We've got all the urinary leakage, urgency, and frequency. You might not realize that those are pelvic floor concerns. Constipation, hemorrhoids, GI concerns, pain, back pain, hip pain, pelvic pain, pain with intercourse. And then we've got some pelvic or pregnancy changes that can happen. DR, I just shortened it because that's called diastasis recti, or the ab separation that can happen. There's different concerns with pregnancy, postpartum, and then tears after birth. So we're going to go through these. And I'm really sad that my images aren't coming through. Hold on. Because now those images are kind of important. All right. Sorry, guys. Give me 1 second. Huh. Okay. Sent. All right. Can you guys see this now?
Yeah.
Okay. So this, we're going to just kind of walk through what is a prolapse. I'm just going to call it prolapse, even though it's pelvic organ prolapse. It's just easier for me to say. We're going to highlight this first image here. This one is normal anatomy with no prolapse. It's as if you're looking sideways from somebody internally. Okay, so this is like their inner thigh. Here's the bum, and here's like the front of the pubic bone. Okay, so in this image here, we're showing that we've got the bladder, the uterus, the vaginal canal, and the rectum, all sitting up and elevated where they're supposed to be inside the pelvis, right? So they're happy. They've got enough supportive structures that are helping out keep those elevated. What can happen and what often happens with pregnancy and other conditions, it can happen to everybody, not even like not exclusively pregnancy or childbirth. But this one specifically shows that the bladder loses a little bit of its support structure from above, and it starts encroaching on the vaginal canal. So sometimes people will say your organs or your bladder's falling out or your uterus is falling out. It's not really falling out. It's just pushing into the vaginal canal. So if you were to look inside the vaginal canal, you would see a little bit of extra tissue kind of coming down. Does that make sense? Anybody have questions they want to chat through?
No, that looks good.
Okay. So the differences and the main ones that we can have kind of prolapse would be the bladder. The bladder can lose its structure and then pushes down into it. You can have the rectum kind of lose its supportive structures and kind of pushes into the vaginal canal, because that's the way out essentially of our body. So if these aren't getting their support strings and ligaments up nicely, then they kind of start to droop downwards. And then the other one would be uterine. So if you can kind of tell, we don't have much of a vaginal canal here anymore because the top part has kind of descended downwards. Okay, so this is why it's so important to have really good core strength and breath management. I have my little chicken here. Because if we don't, and we're pushing and bearing down, right, then you're kind of pushing out some of those tissues. This is dramatic, okay? You're pushing into some of those structures and tissues when really, if you have a relatively low-grade prolapse, you can manage your core pressure well enough that you're not pushing downward into the pelvic floor and just reinforcing this prolapse, which is why it's so important that even if you don't have a prolapse, that we manage our pressure in our core when we're lifting really heavy weights or when we're doing exercise. So not to say that like just because you're a runner or you lift heavy weights that you're destined for a prolapse, but we just want to be mindful of it and aware. So one really cool thing that we can do that's not surgery. So some people, if they have a very severe prolapse and their tissue is actually pushing so much that it's on the outside of their body, then surgery is usually the best option. But if you have a prolapse where if it bulges downward, but it's still within the vaginal canal, there's something called a pessary. And this is an example of a couple of them. And depending on your body, the way your anatomy is, there's different shapes and sizes of these pessaries, and they go up into the vaginal canal and provide a little extra support. Some people say that they run with like a tampon in, or there's some that you can get kind of over the counter that insert almost like a tampon, and they're single use. You just throw them away. But some people get these officially fitted for them. I do not do pessary fittings, but I just want women to know that they exist so they can ask their providers for referrals and information if they are experiencing symptoms of prolapse. Some of the symptoms of prolapse would be heaviness, achiness. It feels like really fatigued. You know, when your muscles are really tired, they kind of burn, they fatigue out. And sometimes people feel almost as if they had a tampon in and it was falling out just a little bit. So those are some of the common symptoms of a prolapse. Okay. Anybody want to chat about this a little bit more before we move on?
Yeah, you did a good job.
Okay. Well, we can always ask questions at the end if you realize one that comes up, okay? Okay, so let's talk about some of the bladder, more bladder-related pelvic floor concerns. So this would be the urinary urgency, frequency, and leakage. So some people have leakage when they cough, sneeze, jump. Some people have leakage just because they can't really coordinate their pelvic floor muscles and they don't even know that they're leaking. It just happens. So I really like to go through in depth how the brain works and how it sends signals to the bladder. Okay, I'm not going to do that for you guys right now, but essentially you have this like loop of you've got the brain, the spinal cord, there's nerves that send signals to the bladder has senses and a nervous system that sends signals back to the brain. Okay, so when we have poor toileting habits, we reinforce in our brain that we need to void more often and go more frequently and have more like this intense urgency. Do you guys understand when I say urgency, where it's like I gotta go now? You're like, nothing's gonna stop me, nothing's gonna get in my way, and I'm running to the bathroom because I might pee my pants. Like I gotta go. Might not be that extreme, but you know what I mean. So one thing that I really like to enforce and reinforce for all my clients to do is to know when their bladder is actually full enough to go to the bathroom. So when we practice sensing, the bladder needs to expand enough and fill up with enough urine that we can void without going too often and retraining our bladder. Because if you start to go to the bathroom and you're really only filled up like a third of the way or even half of the way, but you're like, might as well go, you know, I'm bored, I need to get up, I've been sitting in my desk or watching a show, that sends a signal back to the brain and is like, oh, okay, so we need to go pee when it's here. Can you guys see how if you did that over time, it would retrain your body and brain to not tolerate being full?
Mm-hmm.
Okay. So one thing is, don't go to the bathroom just in case. I'm just going to go just in case, you know, or I'm going to leave and drive to the store. I don't really want to use the bathroom there. I don't have to go now. I feel it. I don't have to go now, but I'm going to go just in case so I don't have to go at the store. So that's an example of a just in case pee. Try to limit those.
Mm-hmm. I think for trained that way when we were kids, right?
Yeah, we're leaving the house. You better go pee right now. We're not stopping for you. I mean, car rides, if you're going cross country, that makes sense. Okay. So,
Habit with me, you know, I'm going to go somewhere, so I go to the bathroom if I have to or not. So that's not good.
it's just, yeah, it's reinforcing the loop of being like, okay, the brain's going to tell me now that I have to pee, even though it's not all the way full.
Okay.
So you can actually do the opposite too. So some teachers and nurses have an issue with this, where they hold their bladder until it feels like it's going to burst, and they haven't gone for hours and hours. And then they have to go to the bathroom, and sometimes their bladder is so distended that those muscles can't really contract, and they almost have to like force it out, like just with their abdominal muscles, and squeeze and push it out. That's the other extreme, where we've waited too long and the muscles have stretched out and they don't have a good contraction, if that makes sense. So toileting habits is one of the main things. And then also limiting bladder irritants. So some bladder irritants are caffeine, carbonation, chocolate, citrus, alcohol, all the fun things.
All the fun things, yeah.
Not to say you shouldn't drink this or shouldn't eat or consume, but in moderation. And if you're experiencing a lot of pelvic floor dysfunction, for a small time, it is nice to kind of dial it back and then kind of build up your coordination and things like that. So we'll talk more about like treatments of this in the next webinar. Most of the time it can be global, you know, most of these principles apply to most everybody. But yeah, there's GI issues, constipation, and hemorrhoids. So definitely the squatty potty is a real thing. So if you're sitting on the toilet, having your knees slightly elevated on a stool is a good option. It puts the pelvis in a good position so that the rectum is easier to void. Okay. So that's a really good thing. So making sure you have enough water, you have enough fiber, you're not pushing and bearing down, like I talked about with this little prolapse guy. So we don't want to push down like we're straining so hard. We almost need to practice that big breath, the diaphragmatic breath. Let the pelvic floor relax. And then while it's lengthened and relaxed, then you kind of breathe out and then void. So just some good toileting reminders there. Okay.
I have a question.
Yeah.
It's a squatty potty.
Yes.
Where do you buy a squatty potty?
So you can get it. It's just a stool that fits around the bottom of the toilet, so you can pull it out and rest your little feet on it.
Oh, I know. Okay. I've seen those.
Yeah.
Okay.
Or you just get a stool. The squatty potty design is nice because you can push it back and it's hidden underneath the toilet.
Okay.
Yeah.
Okay.
Okay. Let's talk about pain. So a real common one is pain with intercourse. Some people have tearing and scars from birthing a child or trauma. And so those tears, they don't heal with the same amount of elasticity or stretch, right, as regular tissues. So it can become tight, uncomfortable, painful with intercourse or any sort of penetration. I know a lot of people experience really bad pain with like OBGYN appointments and things like that. So we really want to improve that scar mobility. And so sometimes We use dilators, which are just a sequence of kind of little tube-like things that you insert into the vaginal opening. They start off very small, and then they gradually get bigger as you build up tolerance to that. Pelvic floor tension is huge. Sometimes we don't know that we're holding our stress in our pelvic floor and everything is ridiculously tight. But those muscles, just like any other muscles, right? A lot of people hold their jaw. They like clench their jaw. Some people hold their stress in their neck. The same goes for the pelvic floor. I have an unfortunate light hitting me. Hold on. Let's see if I can block it a little bit with my plant. Okay. So that pelvic floor tension can cause encroachment on our nerves. This part of our body has so many nerves in those muscles that's highly innervated. And with that tension, it's almost like you're squeezing on those nerves. And so some people have like burning, sharp shooting pain. Some people have radiating pain, and that would be like traveling pain. So they might feel it right here in their pelvic floor, but sometimes it can radiate to the hips, to the glutes in the back. And so some people, they're like, I can't find where my pain is. A lot of times it can be pelvic floor referred pain. So referred pain is similar to how our body refers pain in a heart attack. You know how they're like, well, it's the arm, it kind of shoots down the arm, but they're having a heart attack. Different sets of nerves, of course, but similar systems, we have referred pain. Okay. Does that kind of make sense about why we would have pain in the perineal area and the surrounding structures?
Yes.
Okay.
Yeah.
So a lot of times in the clinic, what I'll do is I'll assess the pelvic floor muscles, and you can feel the tightness of them. And if you compress or press on them, people are like, ooh, right there really hurts. Or sometimes I can push on it and it sends pain to their back or to their hip. So that's very good to find, right? I want to reproduce the pain so that we know this is the area that we're going to work on. Michelle, are you there and able to answer a question for me? If not, that's okay.
Yes.
Okay. So if you wouldn't mind sharing, you're currently going through pelvic floor physical therapy.
Mm-hmm.
And with some sorts of assessment, did you recognize any pain with the assessment that you were like, that's it right there?
Oh my gosh. So yeah, so my gynecologist was delivering a baby. So she had me see the nurse practitioner. They had me see, and she put her fingers in me and I just about came unglued. And I told her to stop, that it felt like she was poking me with her fingernails. And she said, I don't have fingernails. When she took them out, I saw long fingernails that were a minimum of 6 millimeters. And I know that because I measured gums and I know millimeters. And I felt so violated that
Oh, Michelle. Oh,
it was horrible. It was horrible.
That should not happen. So I appreciate you sharing that, because that definitely is something that should never happen, and we should definitely speak out. And I know that when you and I spoke, I believe you submitted this. Yes.
Yes, I did. And you were talking about nurses, holding it for a long time. As a dental hygienist, I sometimes hold it for a very long time because I'm just back to back with patients.
Mm-hmm.
And I try to go to the bathroom before I start seeing patients. And then, it might be hours before, but I'm trying to drink water. And I'm trying to do, but exactly the same thing. And it's. All of that.
A lot
Yeah.
of situational things and environmental factors that limit you from, taking care of yourself,
Yeah.
are things that we can try to advocate for in the workplace, which can be intimidating and hard, especially when this is your career and your livelihood and things like that. But even just I need a 5-minute break between, these
Yeah.
specific times to be able to go void. And I know, like, if you're back to back to back and you're probably, a lot of times they're running behind. So it's like, I can't even take that time because we're already behind.
I know. And sometimes you just got to do it and you run further behind, and that adds to the stress, which adds to the clenching of the glutes and the muscles and all of that. Yeah.
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 Yeah. So it would be nice if they could work with you and like understand your health matters, right? Because it's not
Yeah.
only like your efficiency at your job as well. Like, if you're healthy and you feel good, you're happier at work, you're going to do a better job.
Yeah. So I've cut back from full-time to part-time, partly because of this. Yeah. It's just too much on the body. The stress, the whatever, 31 years full-time. I'm like,
Wow.
That's
okay.
that's a huge commitment.
Yeah.
Which reminds me, Michelle, my husband and I would love to come to your place of work and do a workshop, and we could advocate all of these things, workplace
awesome.
health.
So the doctor I work for now, he's very kind, and it's
Good.
he has massage therapists come in, so maybe we can work something out.
That would be great. Okay, well, thank you so much for sharing that. Okay,
Of course.
so I know y'all still on the call are probably in the postpartum phase, and you'll always be postpartum because it's after birth, right? And so if you've had kids and it's been 40 years, mom, then you're still technically postpartum. But obviously not in the early phases where we would be worrying about some of these things. But I mentioned before the ab separation that can occur. And that's pretty normal for a lot of things to happen because our abs in the front, like if you're thinking 6-pack muscles, they need to expand to make room for baby. That's just how they are. But a lot of times within a year, they will close. Some people who have a lot of abdominal fat deposits internally, so like visceral fat, they might have this ab separation as well. So that is something to be mindful of, is managing a healthy weight. We're not talking about supermodel status here, but visceral weight can pack on, especially perimenopausal, menopausal. And so this is something that we would want to just be mindful of. And then we already talked about some of the perineal tears that can happen. And then the scar tissue pliability would apply to if you had a C-section as well. And then postpartum, a lot of times there's pain with feeding postures, neck, back, hand, because you're having to do all these awkward postures and things like that. So this is the ab separation that we're talking about here. You can kind of see right here, this is called coning. So even if you don't have a very wide separation here, you can still notice some bulging up if you're not managing your core muscles very well. So we really want to make sure that we're not pushing outward here, but more creating like a 360 canister of tightness with our muscles. Just briefly here, this is a C-section, just to kind of visualize where that would be if anyone's ever had those. So, okay, so here's some perineal tearing that can happen. We'll just talk briefly about it. First degree would just be, so this would be vaginal opening, just going outward through a little bit. Second degree would be going into this middle part between the vaginal opening and the anus. Third degree would be actually some tear of the anal sphincter. And then 4th degree, which really sorry if this has happened to you, would be vaginal wall all the way through the middle area and through the rectum. So definitely something to be mindful of. So a lot of women don't even know what degree tear they had, which is something we want to ask, right? If you got stitches, so I had a 2nd degree tear, and I asked, I was like, what tore? How many stitches? Where did you stitch? Right? Because I wanted to know where I was going to have scar tissue. So that's something that you can advocate for. But if you don't know to ask, then you don't know to ask, right? And they're not going to just tell you. They're just going to stitch it up and say, see you in 6 weeks. Okay. Mentioned briefly here about some of the feeding postures, and this works for like workplace postures as well, and how we hold our stress. A lot of my pelvic floor clients also have neck and jaw pain, and so a lot of us, when we're holding stress, we're going to hold the pelvic floor, the glutes, the adductors, all of that. So for moms, I've recommended, and this could be people who just work at a desk or sit. I call it tummy time for mom. So babies need to go in tummy time, and so does mom. And then that helps strengthen up the support system of the back and the neck. Okay, so we've come to the end of the line, but are there any questions?
Let's see. Okay, so how does the diaphragm breathing help? I'm
How does
still
that help?
confused.
Okay, no, that's a good question. So when we have a very tight and kind of sturdy pelvic floor where it's not movable, right? So if it's really supported and elevated and tight, then when you try to move or breathe, right, it doesn't give. And it's supposed to be more like a trampoline that gives with pressure, because you're going to build up pressure in your core just living life, right? We move, we bend over, we pick something up. So your diaphragm is almost like a cheat code of how to help you move or mobilize your pelvic floor, because aside from having somebody like me, a pelvic floor therapist, go up to the vaginal canal and manually like stretch out some of those muscles, if you use your diaphragm and allow the pelvic floor to relax, it's like a way to stretch from the inside out.
Okay.
And then with the control of the pelvic floor being able to relax, then it's not stuck in this contracted, tight position all day long.
Okay.
Like if you had to hold your arm like this, holding a weight all day, do you know how fatigued and painful and tight your biceps would be, right? As opposed to being able to be like, oh, I can relax it. And then when I need it, I can contract it. Oh, I can relax it. If your nervous system doesn't know how to relax your pelvic floor, it stays tight, tense, compresses on those nerves, causes that irritation, pain, and can contribute to the leakage and things like that.
Okay. Thanks. I need to keep practicing. Sometimes I forget about it.
Sometimes, just some of my clients say, oh yeah, I just heard your little voice today when I was getting really stressed and I noticed everything tense up, to just breathe. Just let the diaphragm expand, let the pelvic floor expand. And it's something that you can do while driving, like if you put like a habit together with a habit that you're already doing. So if you are at a stoplight, oh, look, a red light, darn it. Oh, I can breathe, right?
Oh,
Right now.
okay. Okay. That's very helpful because I forget so many
Yeah.
to
So
do that.
sometimes your body is going to remind you. Like if you're prone to pelvic floor tension, you're going to start to feel it get tense and tight. And that should trigger the response of, I need to breathe, calm, stress reduce, relax, find some way to take 10 seconds to just breathe and really calm the nervous system down, because pelvic floor concerns are very nervous system heightened. And we have to retrain the nervous system just as much as we have to like manually release some muscles. Then how do we keep it from coming back, right? We need to change the nervous system. Okay, we've got a question here.
Good. Thank you.
Yeah. Thanks. What are some exercises we can work on to help with engaging our core? Okay. So there are some very beginner-friendly core exercises that you can do. It's hard to kind of show them here without sending you like through a video, but essentially what you want to be doing is when you expand your core, to be able to brace it properly, you need to, so I'm going to stand up here. So imagine that I'm doing some sort of exercise, right? It could be a core exercise. It could be just squats. It could be literally anything. So when I breathe, I want everything to expand here, here, here. And then an easy one is to just draw in the whole stomach like that. So do you see how it like came all in together versus some people go like this? You see the difference when I push out? Can you see the difference between pushing out into it and right? So you want to draw tight, but not like suck it in. Sorry, I didn't wear the best shirt for this, but like sucking in would be like that, where you lift the rib cage. So here's bracing. And then it's tight from here all the way up and all the way around. That's tight.
Mm-hmm.
But I didn't push out and I didn't suck in. And then some people, they do what we call as ab gripping. They try to tighten, but they're just doing this, the top part. And the belly pooches out because they're just tightening up here. Versus everything together. So Amber, with your question of like, what exercises can we work to help with engaging our core? One thing that I would start with is just lay on your back and knees bent, big belly breath, exhale, and draw the stomach muscles tight. They won't be like sucked in, right? They're just tight. They're not bulged out by bearing out. And that's one of the first things that I'll have people do is like inhale, relax the pelvic floor, exhale, draw those muscles tight. Now, if you have an excessively tight pelvic floor, please do not try to Kegel at that time. So when you brace through your core appropriately, the pelvic floor will respond and support. Okay. So what a lot of people do is they feel like they need to Kegel all the time or do a contraction of their pelvic floor. This isn't always necessary. Now, if in your assessment, your therapist or you could stick a finger up your vaginal opening and see when I inhale, does my pelvic floor relax or descend? When I exhale and tighten my core, what does my pelvic floor do? Does it bear down? Does it lift? You can kind of sense those things yourself. to be able to determine if you might need to work on engaging the pelvic floor or not. But yeah, Amber, do you have any follow-up questions with that? Because it's more of like how you're doing them and not necessarily like which specific exercises. Feel free to type that in the chat if you would like. Okay. So does anybody, oh, Amber says her mic's not working. Okay. And we can always chat about this later. If you guys need more specifics, we can talk through it. I do have, hopefully coming soon, a group for different diagnoses, and we're going to do group therapy because a lot of times we can do this together, and that way, you know, you have more friends to support you with it. But if there's no more questions, I'll let you guys go. I know I ran over my time, but anybody last minute questions?
No, but thank you.
All right. Sounds good. Well, I'll hang here until you guys all leave, but thank you so much for your interaction and sharing, Michelle. I really appreciate you, and I'm so glad that you're getting help. But I'm here to support you guys.
Thank you, Lindsay. I really appreciate you.
You're welcome.